Good morning, class. So this is our sixth topic entitled Legal Aspect of Intravenous Contrast Media. So I have a lot of reference for this discussion. Before we start, let me leave this line to you. Ignorantia leges neminem excusat. So I guess you're very familiar with this. It simply means ignorance of the law excuses no one. Di ba, we know that per state, we have our own law, we have our own ordinance. So what is allowed in this certain barangay or in this certain city may not be allowed to other cities. So you have to know that before diving in to their community. So the same is true with our in medical field as well. You have to be familiar with the laws and regulations and policies, and you have to be aware of the guidelines. That's why we did not take those for granted. It can come back to us anytime. Okay, so again, for ignorantia leges neminem excusat, or it could be ignorantia juris neminem excusat. It means the same thing. Ignorance of the law excuses no one. Okay, so legal aspect, we have here the American Society of Radiologic Technologists, Senate Bill 571. So ASRT authorizes radiologic technologists under the general supervision of a physician and surgeon to perform venipuncture in an upper extremity to administer contrast media manually or by using a mechanical injector if the RadTech has received specified training and education and has been issued a certificate from an approved school of radiologic technology or an instructor indicating satisfactory completion of the required training. So basically, you're only allowed to perform this if you are certified or under the supervision of a physician. So as I have said, during CT scan contrast enhanced procedures, before proceeding with the examination, you have to inform the resident. Doc, I am about to inject the contrast or the dye. And then the doctor will say, okay, at least na go signal from them. And then you will inform the other staff inside the exposure area na you are injecting. Injecting in 3, 2, 1. So under the supervision and if you have a certificate. Take note of this when you will be interns. Student radiologic technologists may not, under any circumstances, inject contrast media. So learn the art of saying no. Okay, if some radtechs, no radtechs will ever allow you or will ever ask you to perform the injection because it will be their license. It will be their licenses who will be at stake. So from your side, from your end, you have to say no, we are not allowed. Under any circumstances, we are not allowed to inject contrast media. And then we have the RTCC or the Radiologic Technology Certification Committee, Health Safety Code, sections 106985. A radiologic technologist certified pursuant to the Radiologic Technology Act may, under the general supervision of licensed physician or surgeon, perform venipuncture in an upper extremity to administer contrast materials manually or by utilizing a mechanical injector if the RT has been issued a certificate as described in subdivision. A radiologic technologist may perform venipuncture as described in A only if the radiologic technologist has received sufficient training and education as specified in subdivision D. The radiologic technologist shall be issued a certificate by an approved school of radiologic technology or instructor indicating satisfactory completion of the training required. General supervision for purposes of this section means the direction of procedures authorized by this section by a licensed physician and surgeon who shall be physically present within the facility and available within the facility where the procedures are performed in order to provide immediate medical intervention to prevent or mitigate injury to the patient in the event of adverse reaction. So that's why they should be physically present in case of any adverse reaction. And also an emergency card should be present as well. Okay, so letter D, training and education is deemed sufficient if the radiologic technologist has complied with both of the following. So we have 1 and 2. So for 1, received a total of 10 hours of instruction, including all of the following: anatomy and physiology of venipuncture sites, venipuncture instruments, intravenous solutions and related equipment, puncture techniques, techniques of intravenous line establishments, hazards and complications of venipuncture, post-puncture care, composition and purpose of anti-anaphylaxis tray, first aid and basic cardiopulmonary resuscitation. So class, this is the reason why we have pharmacology and venipuncture. Actually, from the old curriculum, it's only venipuncture, but now pharmacology is added as well for us to learn a lot from contrast agents and their mechanisms in the body. Before, when we had our venipuncture, our final exam was, we don't have laboratory equivalent sa venipuncture na during our time with Miss Kizzy. Our final exam was to inject, to collect blood. So we really performed venipuncture to our partner, and that served as our final exam. I haven't tried that last time because of COVID. During our pre-final and final exam, COVID hit Cebu City, di ba? So, last time we were not able to perform that as well, and I'm really hoping that your batch, but no, we don't have we don't know yet, even though there's vaccines already. So there's no news of blended learning or flexible learning, maybe next sem. But for now, so we are all theoretical, and I will be providing you a lot of video on how to make a puncture, on how to select venipuncture site for intravenous contrast media administration. And number 2, perform 10 venipunctures under supervision. Schools for radiologic technologists shall include the instructions specified in subdivision D. Nothing in this section shall be construed to authorize a radiologic technologist to perform arterial puncture. That's why it's IV, intravenous, via vein, via venous, intravenous administration. Per Health Safety Code 106985, certified radiologic technologists may perform venipuncture within limitations. A certified rad tech may not perform arterial puncture. A CRT, certified rad tech, may perform venipuncture if they have received specific training and only on an upper extremity to administer contrast materials. So you are only allowed to administer. You are not allowed to get blood sample. Diba? We are doing the opposite of what the medtechs are doing. Diba? They extract blood. We don't extract anything from the body. We introduce a foreign material, which is much risky. Because you are introducing a foreign substance. So that's for Health Safety Code under Radiologic Technology Certification Committee. So we have A, B, C, and D. This is an important one, training and education. D and E, F. This one. Okay, so we also have the CHED Memorandum Order, or CMO, CHED, Commission on Higher Education Memorandum Order, number 18, series of 2006. So this is the policies. This memorandum is entitled Policy, Standards, and Guidelines for Radiologic Technology Education. This is what we are following now, class. This one, Article 1, Introduction, Authority to Operate, Program Specifications, Competency Standards, Curriculum. So all your subjects, all your subjects for this new curriculum are followed according to the CHED Memorandum Order. So you are already done with this one. Okay, so you get the point. We are following what the CMO number 18 series of 2006. So we are only following this one. You can search this sa Google. It will come out good. I think I'm not sure yet, but there's an updated version of this one, 2013 or 2009. CHED Memorandum Order series of 2006, but this is still the series of 2006. So if you hear this one, CMO 18 series of 2006, at least you have an idea that it is about the policy, standards, and guidelines for radiologic technology education. And all that is outlined here are the limitations of the RadTech, or the intern, RadTech intern. And then next we have OSHA, stands for Occupational Safety and Health Administration. They issued the Bloodborne Pathogen Standard in 1991 to protect healthcare workers from exposure risk. They develops and enforces workplace safety regulations. So I guess you have heard of this already from Contrast, OSHA, Occupational Safety and Health Administration. Center for Disease Control and Prevention, or CDC, they're the primary agency responsible for protecting the health and safety of the public. So we have a CDC main, diba? It's based in US, but we also have CDC ambassador in the Philippines. And ANSAP, Association of Nursing Service Administrators of the Philippines. So in 1993, established the nursing standards on intravenous practice. So the ANSAP established the nursing standards on intravenous practice. Republic Act 7164, Section 27, provides that the practice of intravenous injection by nurses requires a special training according to protocol established. So imagine, we know that the nurses are responsible for injection, IV injection, but still they also need a special training. So the Philippines Nursing Act of 1991 provides that IV administration is within the scope of nursing practice. Republic Act 9173 of 2002, the new nursing law. The new nursing law stipulates that the administration of parenteral injection is a part of the scope of nursing. Therefore, this only strengthens the need to certify registered nurses to ensure competency on intravenous injections. So the original is Philippine Act of Nursing 1991, and then revised RAs 9173 of 2002. Okay, now again with the informed consent, this is very a big deal. This is a very big deal, class, because anything happens to the patient and you were not able to get a signed informed consent, the blame is on you. Okay, so informed consent is necessary for any procedure that is considered experimental or that involves substantial risk. So a certain imaging procedures, especially those contrast enhanced procedures, requires that the patient receive a full explanation of the procedure and its potential risk and benefits. So as the rad tech, as the one getting the informed consent, you should fully understand the procedure and its risk and benefits so you can adequately explain them to the patient and you can answer any questions related to the procedure. Like as simple as, can I eat after the procedure? Can I continue with my routine activities after the procedure? Then you have to know the answer. Yes, ma'am. You have to do is drink a lot of water, fluids for you to be able to extract or for you to urinate the contrast agents. You have to be ready as well, and you have to appear confident that you are sure the procedure will be is being performed by a knowledgeable professional. And then the patient and a witness will sign the consent form. The patient's signature is usually witnessed by the person asking or providing the explanation or you. But for some procedures, providing information and obtaining the consent is the physician's job. But for patients undergoing routine procedures like contrast enhanced, it's very common. Your explanation or it's okay if you will be the one to explain the procedure to the patient in his or her behalf, in the physician's behalf. So informed consent is very important, class. Do not neglect this one. Okay, in any case, I think I can share you something. The patient was pregnant and then she really wants to proceed with her x-ray. So we didn't have a choice since the patient wants to have the patient wants to have the procedure. He wants to perform her chest PA. Even though we know the risk and even though we applied gonadal shielding, thyroid shielding, and abdominal shield, we let the patient sign a waiver that whatever happens to her baby inside, we are not responsible because she know it was explained to her that she can have her x-ray after she gave birth, but she insisted on continuing with the procedure. So as easy as that, class. It's like our safe, what do you call this one? It's like our ace. If whatever happens, it will not come back to us. We have an informed consent to show the patient know the risk and the benefits of this procedure, but still chose to continue with the examination. So natay panglaban. Okay? And then you have to explain to them as well the risk, good, if it outweighs the benefits. But they also have the right to choose and to decide. This one, class, for in the informed consent, the patient must receive a full explanation of the procedure and its risks and benefits and sign the consent form before being sedated or anesthetized. She has to know what she will be expecting before you start with the procedure. And then a patient must be competent in order to sign an informed consent. Only parents or legal guardians may sign for a minor. Only a legal guardian may sign for a mentally incompetent patient. Consent forms must be completed before being signed. Patients should never be asked to sign a blank form or a form with blank spaces to be filled in later because who knows what you will write there. Okay, To some informed consent, you can write the contrast agent that you will be using, and you can, the contrast that you will use, the amount, and the route of administration. Only the physician named on the consent form may perform the procedure. Consent is not transferable from one physician to another, not even to an associate. So if you are the radiographer, you should write there as well, and then the physician will sign as well, and then the physician who will perform will sign, and no other staff. Any condition stated in the form must be met. For example, if the form states that a family member will be present during the procedure, the consent is not valid if the family member is not there. So you have to abide by whatever is stated in the informed consent. Informed consent may be revoked by the patient at any time after signing. This is an invocation of the patient's rights to refuse examination. So, wata ka ba, nag-change of heart siya in the middle of the preparation or during the examination? So you have to explain it to them na once we start, ma'am, you have the right pa to refuse to continue the examination. Then we also have malpractice prevention. Here, the 7 C's of malpractice prevention. Harm may result from contrast media administered without proper precautions or when reactions are not immediately identified and appropriately treated. So there's a lot of malpractice examples that was given, that was written in the reference, but I opted to choose this one since this is about contrast media. You can have a lot of malpractice anywhere in the hospital, as simple as you let your guard down. When we were interns class, I have a classmate who was assisting a barium enema procedure. The patient was an elderly, and she asked if she can use the restroom. The intern was a male patient, and the intern was male, the patient was female. The intern assisted the patient going to the restroom. But after the patient was done, I didn't know if she called the intern to assist her in coming down from the toilet because the intern, according to him, he was busy with the aftercare sa table, namilo sa bedsheet, nagtrapo sa mga nanghipo sa mga equipment nga gi-use. So he was busy with the aftercare, and then the elderly slept while going down sa restroom. Kay sa room 4 where we perform contrast enhanced special radiographic examinations like barium enema, mo step pa man kag 1 step para sa CR, madto ka sa CR. So na-slide ang patient plus, and fortunately wala raman noon siya na fracture or anything, but the thought ba nga elderly ang patient then na-slide, you know what happened plus? An incident report was filed. Kay nireklamo man sa ang patient nga na-slide siya, so naratol ang tanan pagka-slide ni syagit ang patient, and then ang intern nakabantay na slide na ang patient. So kinsa may sadana na ang intern, ang rad tech na assign kay supposedly you only assist the rad tech. The interns only assist the rad tech. So there should be a rad tech present as well. So I think what happened there kay naabot man ni Sir Jared. Sir Jared was the intern coordinator that time. Natagaan og extension ang intern. Wala na lang na-filean og IR kay nahangi raman since ang patient kay butan raman. Gi-assistan man sad siya adayon after sa intern. Pag slide niya, gipabarog raman sad siya dayon. So murag na nadala ra tog storya. But then, abot man ni Sir Jared, so the intern was given appropriate sanction. Kung radtech pa to nakasala class, IR is waiving incident report. that will affect you sa inyong COE. If mo resign na mo, and then mag-ask mo COE, mo reflect man na tanan nimong sanctions dito. Naka-receive na ka o verbal warning or pila ka warnings na latecomer or absent, kana, it will appear. So you have to do good. So we have, okay, so going back, the 7 C's of malpractice prevention. First C, competence. Knowing and adhering to professional standards and maintaining professional competence reduce liability exposure. Compliance. The compliance by health professionals with policies and procedures in the medical office and hospital avoids patient injuries and litigation or illegal act or a legal action. Charting completely, consistently, and objectively can be the best defense against a malpractice claim. So you have to document everything. Communication, patient injuries and resulting malpractice cases can be avoided by improving communications among healthcare professionals. Confidentiality, protecting the confidentiality of medical information is a legal and ethical responsibility of health professionals. Class, you are not allowed to disclose whatever it is you found in the result. If you are the first person to discover that your colleague or your colleague in the laboratory department is positive of, let's say, COVID or positive for PTB, which are contagious, you don't have to disclose it to everyone. You have to wait for the proper action, damage control, to be set by the administration. Next, courtesy. A courteous attitude and demeanor can improve patient rapport and lessen the likelihood of lawsuits. Carefulness. Personal injuries can occur unexpectedly on the premises and may lead to lawsuits. Kani siya, class. The one na example, katong na slide ang patient. And also, class, lawsuits can result in conflict, expenses, professional embarrassment, and loss of public confidence, even when the plaintiff is denied any award. Thus, a great need for caution exists, both in the interest of patient care and in the avoidance of possible malpractice claims. We have to be careful at all times because our license, which we really worked hard for 4 years and then passed the board exam to get, will be at stake. So I think that will be all for this discussion class, since this is about legal aspect of IV. I think you get the idea that not everyone is allowed to perform that. You have to be proficient. Okay, you are injecting a foreign substance into the body of the patient. So these are my references for this topic class, and I really hope that even though this is short and it's pure words, you were able to get something from this discussion. Thank you so much, class, and we will not have a post quiz for this discussion. We will be discussing circulatory system next week. Thank you so much, and I hope you learn a lot. Keep safe.